it's basically so I can do this. All right. Yeah, I'm good. I don't know if I turned my mic on. Hold on a second. Oh, it is. You turned my mic on. I only have like one bit of battery left, though. It's like on the last. It's on the. So, I don't know if that's going to be a thing.
Yeah, because we're going to have a permanent fixed room for video recording where everything stays the same and you won't have to move it around.
Well, once Dan helps decide the layout.
Then we can focus on that as being permanent.
It's like a little harp. Okay. Are we live? Perfect. Oh, hang on. Right, I'm good. Huh? Oh, yeah. All right, this is a little part we like to call warming up the speaker. All right, we're good. We good? Huh? Okay. Good? All right. Where to start? All right. Hi. So, welcome back to the third and potentially final installment of Allergy and Autoimmune Disease, Insights and Uncommon Knowledge. I got a little feedback on my previous presentations that it was a lot of background and not a lot of actionable things. The good news, it's going to be somewhat better this time. Because I realized that to quote the great Carl Sagan, if you want to bake an apple pie, you must first create the universe. And in this world, the immune system and everything that goes to it and flows from it is very, very complex. So I realized that if I was to start to talk about the immune system and how it worked, it got into endocrinology, it got into psychology, it got into nerves, and a whole bunch of other stuff. Today, we're going to start off with embryology. But today, because we're going to start with the wrap-up, we're going to start to take this 3-hour tour down to a parable bite size. It's the wrap-up. That's all I got. Okay. So, we'll start off with a little bit of good news. Almost 6 million children under the age of 18 have food allergies. There are no current recommendations of specific interventions parents can take to definitively prevent allergies in their unborn child. But there's a lot of them. Epigenetics. I'm going to bring this up now, and I'm going to touch on it later. I'm going to touch on it again and again and again. We're going to keep touching it until we understand it. So epigenetics is the control of your genes. Not the genes themselves. Those haven't changed arguably in 10,000 years, but the control of them has. They have a huge role in epigenetics. So epigenetics have a huge role in allergy development. So yeah, here we go. Epigenetic biomarkers are mitotically and or meiotically heritable but reversible. Hold on a second. So mitotically, you can ignore that. That's how they move. So to be fair, I'm talking to a broad range of people here. So if you don't understand some of the things I'm talking about, that's probably not meant for you. I have conversations with professors and other doctors, as well as everyday patients that want to know what they can do for themselves. So if there's a bunch of stuff in here that I have in here that does not seem to apply to you, that's okay. I've highlighted the important pieces, and if you can get the basic components of it, it'll make a lot of sense. Okay, so they are heritable but reversible. That means even if you inherit them from your parents, you can change the way your genes work. That's what epigenetics are. Yeah, you get to rewrite your own programming. They are functional and biologically relevant biomechanical modifications of chromatin, carrying information but not changing. It doesn't change the sequence of the genome. All right, so I have supplied for you this visual. See how nice that is? Genome, chromatin. If you were to inherit a piano, it could potentially be the same piano that's been in your family for generations. However, sheet music is what the piano expresses. So the keys don't change positions, the chords don't change notes. That is the extent of my musical knowledge, by the way. Chromatin, or the sheet music, can change, right? It might have been classical, it might have been boogie-woogie, it might have been, who knows? There's plenty of things that you can play on piano, and those change generation by generation. So if we look back at this, heritable but reversible, they carry the information. Which one of these has information? Genome, chromatin. Yes, the chromatin. Your genome is your library. Your chromatin are the books that you store in stock and the ones that you actually rotate through. So, here we go. 2014 study of Australia concluded there was preliminary evidence of pre-birth programming of food allergies. Why are we talking about genetics and chromatin? Why did I mention heritable like 6 times already? Because the first place a person can develop allergies is pre-birth programming. You could have allergies built into you before you were born. Obviously, you don't get to make any choices about that right now. But if you are a woman interested in having children, know that you can affect their outcomes. If you can notice right down here, there's this little tiny black line. That's the link to the research. So if you see those on there, it's not an error. It's not a piece of hair on the lens of the camera. It's research. All right, carry on. There have been no clinical trials on that theory. There's evidence, but there's been no clinical trials. Why? Because randomizing women into healthy and unhealthy diets would be unethical. We can't do science where we know that we're going to harm people, right? So let's look at this real quick. If we know that dietary choices have an impact on allergies, it is unethical to make a woman eat an unhealthy diet because it can harm her offspring. Let me ask you this. Scientists can't make you do it and then study it because they know it's bad for you. Would you then, as a potential mother, choose to do that to your own child? Allergies start with your food choices. All right, how to get an allergy to autoimmune disease, 101. I figured if we start with that. So if you're a fetus, we have any fetus in the audience? Maternal exposure to antibiotics. We showed that in the last presentation. Maternal exposure to antacids. Maternal exposure to environmental toxins. There's a long list of those. We labeled those as toxicants. If you're not familiar with that or you want some background on it, go back to the first one. Talked about that there. Maternal exposure to viruses. Not all of them, but some of them. Maternal malnutrition. You catching the pattern here, everybody? It's mom's fault, it's mom's fault, it's mom's fault. Promise this isn't meant to make you feel guilty. This is what science has shown, that these are all things that are coming out now that we're able to study them. The advances in technology really help our dissection of this information. So, maternal narrow food selection. So malnutrition, narrow food selection. Do you see how those two are different? Malnutrition means either you're not getting enough food or you're not getting the right kind of food. In narrow food selection, you could eat healthy, but if you eat 2 vegetables instead of 20, it makes a difference. Maternal poor health. You can see how all of the things up above that lead to poor health, and poor health leads to chronic inflammation or a chronic stress response. They've done studies to children, or on children that were born to mothers that lived through crises. And they've shown that even a stress response can change your physiology and your biology enough to create an increase in allergy or autoimmune disease. Yeah, yikes. Cigarette smoking, preterm birth, cesarean delivery. Wait a minute. You know, your immune system involves not just human cells, but all the bacteria and stuff too. So cesarean delivery changes the biome, the gut microbes, and then being born in autumn. So all of us autumn babies, we're more predisposed. All right, How not to get an autoimmune or allergy. All right, fetus. This again for all you fetus out there. Maternal diet that is nutritious helps. Maternal diet that is varied, that is with healthy fats. They've shown that omega-3s, polyunsaturated, we'll talk about that in a minute, but so healthy fats, super important. So a lot of ladies are concerned that they don't want to put on a lot of weight while they're pregnant. If you get a good amount of healthy fats, it will help with that, not only for your maternal health, but for metabolism, as well as decreasing the allergenicity and autoimmune potential for your child. Maternal digestion that is complete. If you haven't seen the first one where I said digestion, 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 and I just kept, digestion super important, because if you don't, you think back to those programmed cell receptors that look for protein patterns. If you're not digesting your food, those proteins are under attack and it causes the inflammation level to go up. So lower maternal inflammatory status, that's another very important thing. Obviously, if you compare this list with this list, this is basically the inverse, right? Up until we get down to a few down here where it says larger families, oddly enough, if a child is born into a larger family, they are less likely to have autoimmune or allergies. Don't know why that is, but there's a few theories on it. Healthy in utero growth, obviously if there's complications during pregnancy. Full-term gestation, so preemies sometimes will have, that's kind of the opposite of the preterm birth here. Vaginal delivery, that's the opposite of the cesarean, because there's a whole bunch of biome that gets transferred over. Breastfeeding. Breast milk contains the immune system for the child. So if they don't get that, then they're also lacking out on the probiotics as well as other proteins that basically are their immune system. So if you are pregnant or looking to become pregnant or know somebody that is, this information can help them with their children. And there is a huge explosion in allergenic children, all sorts of weird food allergies and other airborne allergies that are significantly increased from even just 10 years ago. So paying attention to some of these will give you a better chance at having healthy kids, which is, I think, what most families want. And then check and correct for epigenetic factors. There's that word again, epigenetic. Here's some more research to back up all the things I just said. So all this stuff right here, boom, look at this, facts. Okay, maternal dietary components such as monounsaturated fatty acids, polyunsaturated fatty acids, and fiber. What? Why did I underline fiber? Anybody can tell me? Can anybody tell me? Fiber? Anybody? What does fiber do? Fiber feeds your gut bugs, your probiotics. So fiber is what your bacteria use to have a healthy, happy environment. All those three things, fat and fiber, were positively associated with some immune factors. What that means is when a mom ate a broad and varied diet that was high in good fatty acids and fiber, better immune factors for their kids. Mothers confer natural passive immunization to their infants through transplacental pathway during gestation period. So, natural passive immunization. If you have it, one of the beauties, one of the miracles of birth is that the mother prepares their offspring for the environment they are living in. So if you need something, you're supposed to get it through the placenta during gestation. Pregnant woman's diet consists of many products such as, this is a way that you can avoid having allergenicity, such as fruits and vegetables, a bunch of other stuff. So why is fruits and vegetables important? Because it has nutrition and fiber, right? Both of those things are included. Okay. Various commercially available dietary supplements. That was listed in the research. There's a few other things in there which contain a high number of biologically active plant-derived compounds. Those are the polyphenols they're talking about. These compounds play a beneficial role in women's health and the development of fetus health. So, if a woman has good diet, and that can come from whole fruits, dietary, fresh fruits and vegetables, fantastic, we love it. However, I have seen some ladies, for whatever reason, their body either produces a big baby, they have a high metabolism, they have twins, where their body starts to get overloaded. Maybe I've also worked with women that have had a lot of nausea, and they have a hard time keeping things down. So they really struggle with eating all the fruits and vegetables they need. So it's nice to see that there are ways that we can work around that and still make sure that mom gets what she needs and baby gets what baby needs. Okay. Now, let's have this conversation. Yes, this is for fetus. Does it stop then? Like once you're born, poof, everything's great? No. You don't need just water and sunshine. You're more than a plant. So a lot of the things that we're going to talk about early apply to everybody else after this point, but I wanted to use this as a jumping off point to show you that it can start as early as pre-birth. All right. While a mother can't always control the way her baby is delivered, exclusive or supplemental breastfeeding may be helpful in the reducing the rate of onset of the overall burden of allergies in children. Ta-da! What's really interesting about this is there are entire organizations that for women that produce a lot more breast milk than they need, they can actually freeze it, send it, and they share it for children that don't have breast milk, and it's shown to be effective to help the children. So breast milk is the best way to go for helping to reduce the rate of onset. So two things, rate of onset. So the worse it is, the faster children develop allergies, the sooner they develop allergies, and if it starts sooner, it can also get really bad, and that creates the overall burden. Make sense? Here we go. Oh, look at that, so cute. Babies. Moving on. Dun, 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 to the food years. All right, I broke this up by age. The first known ingestion of foods often causes allergic reactions. Think about that. One of the things we talked about is if you don't digest food well, eventually you develop an allergy to it, right? Well, there's this other thing that says it's the first time a child eats something, that's when you find out they're allergic to it. How does that happen? Right? What things trigger an allergic response in a child? We have all kinds of environmental toxicants. And I'll be honest with you, putting this together, I had so much information organized because I was just so excited to share all of this with you. I broke it up into the thing that affects the age groups the most. With children, it's usually toxicants because their immune system isn't really great at that point. And it turns out the more hits they have, the worse it gets and the more likely they are to develop allergies. Throughout different times in life, you'll end up with different triggers that are the main trigger. We'll talk about those as we go along. But I want you to keep this in mind. What happens before they eat their first bite of food? What things can happen in a child's life that they can be exposed to? Because that's a curiosity to me. Now, obviously, it could be the fetal environment. So, I pulled this from the previous presentation where we talked about it, and I even highlighted right here. Boom, early years, toxins. So, plastics, mold. Mold is an airborne allergy. It can cause all kinds of issues with kids. Lipopolysaccharides, pharmaceuticals, metals, heavy metals, air, water, soil pollutions, mineral oil, malnutrition, prolonged eating period, indigestion, yada, yada, yada. Typically with babies, we don't see a lot of PTSD. I have worked on some children that like 2 or 3 days old, they had a heart defect that had to be surgically operated on. And it's hard to say because memories aren't really formed very well at that point, but there's definitely been some complications and things that we've worked around and helped them resolve, which has been really nice. So, all right, so just take a moment to appreciate the sadness of children and toxins. Okay, moving on. All right, organophosphate pesticides are widely used in agricultural purposes. Recently, few studies have demonstrated the ability of these chemicals to alter the function of the thyroid gland in humans. Now, the limitation of this, like I said, we can't purposefully harm people, right? We can't give people a bunch of toxic chemicals and see what happens. So we have to do it from observational studies. So there are some limitations to this. And one of the things they looked at was just thyroid gland function. But it's been shown that pesticides can cause that. So pesticides in food, pesticides in the environment. Hopefully your kids aren't running around at a park rolling in pesticides. All right. The present work was to investigate. This is a study that was done with celery, flavonoid extracts. So the word flavonoid right here, that's a chemical compound, and this was extracted from celery to reduce the oxidative stress induced by this dichlorvose, which is a pesticide. This is one of the things that they found, the observations presented, lead us to conclude that the harmful effects of DIC, which is the dichlorvose, during exposure, and the protective role of flavonoids in minimizing these effects. So they had a study they took, and they exposed a bunch of rats, because rats have a similar immune system to us. They gave them a bunch of this chemical, this dichlorvose here, and they gave some of them celery extract and some of them not. And it showed two things, that they took a bunch of rats, gave them pesticide, it harmed them significantly. They gave some of the rats the pesticide as well as the flavonoid, and it helped to protect the deleterious effects of the environmental exposure of pesticide. So, moving right along. So, I'll be honest with you, I had a little moment in my head where I was like, should I talk about this? But I am just reporting on science. So I am not anti-science. I am not anti-vaccination. I will tell you that there are things that we need to explore, discover, and improve. I think that's true of all disciplines in medicine. I think we should always strive to continue to get better. There was a study that was done with vaccinated versus unvaccinated children. They looked at homeschooling kids because they have a more isolated environment, less environmental exposures. So they were able to have a better correlation. And again, we're not like, forcing people into one of these groups or the other. They were self-selected. So here's the results of the study. The vaccinated were less likely than the unvaccinated to have been diagnosed with chickenpox and pertussis. Well done. The vaccines did what they were supposed to do. But there was a side effect, and this is one of the big arguments of this whole paper was like, hey, we should look a little further into that because it's not for nothing, right? They're more likely to have been diagnosed with pneumonia, otitis media, allergies, and that's the focus of this talk here is allergies, that's why it's highlighted, and NDD. That's neurodevelopmental delays. So that's like brain stuff, ADD, ADHD, anxiety, depression, those kind of things. So there was this study that was done, preliminary, there's a lot of limitations of it, but it did have very conclusive evidence based off of the parameters of the study. The strength and consistency of the findings have apparent dose-response relationship. So they actually compared three groups. They sliced and diced the data a little bit, a couple of different ways to look at it, to see if they could draw different correlations. So there was unvaccinated, partially vaccinated, and fully vaccinated. And it turns out that there is a dose-response relationship, so the more, the worse, right? Between vaccination status and several forms of chronic illness, and the significant association between vaccination and neurodevelopmental disorders all support the possibility that some aspects of the current vaccination program could be, and again, you can't say what's going on in these kids' environment, that there's plenty of factors that we can't account for all of them, but this is saying, hey, we noticed there's this dose response with strength and consistency that could be contributing to the risk of the childhood morbidity. And here's the thing, if there's any way that we can improve the health of our children, I think we should look into it. I think it's worthwhile. We know that from the previous talk, we do know that some of the adjuvants in those shots are harmful, and that allergenic diseases can be derived directly just from those. So we got to make sure that we're doing our research and furthering to study ways to make that safe. Okay, humans. This is a fantastic study that was done using AI, so computer technology, to basically take massive amounts of data and compress it. Humans are invariably exposed to complex chemical mixtures. Estimating the health effects of multi-pollutant exposures is of critical concern to environmental epidemiology. This I put in here for a very specific reason. Because, here, most health effect studies focus on single agents or consider simple two-way interaction models. So this is the current way we're doing things. It's not enough. So most health effects studies focus on single agents. We don't live in a world where single agents is a real thing. That's not a real live study. I mean, it's granted, with the rats we saw, if we're giving them pesticides, it's bad for them. We give them celery, it helps. That's what this two-way interaction model is talking about right here, right? But we live in a complex world. We lack the statistical methodology to more realistically capture the complexity of mixed exposures, which is how we live in a world. So what I realized is we know generally that it's bad and harmful, but we don't know specifically and as scientifically as we should what all is happening in the soup that we live in, right? All right, give me 1 second here. Apparently, it's 700 degrees in here. Okay. That's what happens. Light up a room. Okay, so this basically says that we have to use better models to have a more realistic view of the world. So what you're going to get today, and probably for the rest of the presentation, is a bunch of little tidbits. And it's my hope that by putting all these little dots on your map of reality that you're going to start to see the big picture. Because there is no real big picture to point to. We don't have it mapped out to the point where we can say, okay, well, here's this, here's that, this is what we do. But there's a lot of really good information, and I mean a lot. But, all right, so genetic features, epigenetic modifications, and alterations of intestinal flora may play a pathogenic role in development of food allergies. Hold up. So, genetic features. Do we change the genes? No. Epigenetic modifications. Can we change the epigenetics? Yes. And alterations of intestinal flora. What does that sound like? What do we know that it impacts the intestinal flora in a negative way? Antibiotics. Remember one of the original slides we talked about? It's a child has an early life exposure to antibiotics. It can mess them up forever. It's true, and that's what this is saying here. They may play a pathogenic role in the development of food allergy. Now remember, everybody's living in soup all the time. And we know that, on average, some people that have worse intestinal flora or epigenetic modifications, or they might have just been born that way, right? Sometimes the gene gets broken down over a long enough period of time. Some people are just born with more allergens. We know that these things are contributing factors. These make people worse. We're still talking about early years here. Genetic factors are crucial for the development of food allergies. However, in human evolution, the increase of food allergies occurred in a relatively short period of time. Well, hold on a second. So we know genetic factors are crucial, but the food allergies that we're dealing with developed over a very short period of time. What could do that, you might ask? It cannot be solely the result of germline genetic mutations. Environmental factors can also induce epigenetic changes in gene expression. So here we have, very, very clear, I think. Tell me if I'm wrong. All right, so the change cannot be simply described by germline genetic mutations that happen over a long period of time. However, we know that environmental factors can also induce, right here, induce epigenetic changes in gene expression. So sometimes people say, oh, it's in my family. Everybody has that. Well, yeah, do you guys live in the same environment? Do you have the same environmental factors? Because if everybody's being exposed to mold, to lead, to plastics, to pesticides, to whatever it is that's messing you up, right? What if all of you have a terrible diet? What if the only thing you eat is something that comes from a bag or a box, right? What if fresh isn't part of your diet? Does that affect an entire family? Yes, right? You inherit a lot more from your parents than just your genes. And I've known parents that are really well-meaning that want to keep their kids healthy, and their kids decide to go be rebellious and eat a bunch of garbage. And that can absolutely change your genetic expression. Okay, how not to get an allergy. Here's a fun study. Introducing previously feared foods such as milk, eggs, nuts, and shellfish. If you have an early introduction to peanuts between 4 months to 11 months old is associated with a reduction in peanut allergy. It was significant. Same thing with egg. A cooked egg between 4 to 6 months was associated with a reduction in egg allergy. So one of the reasons why I put this in here is because it used to be conventional wisdom that you waited years to the end of a year or 2 or 3 years old before you introduced them to things they might be allergic to. Turns out, if you start them with a wide and varied diet, right, there's a new theme, we're picking up where that one left off, that they're less likely to have allergies. All right, there was a high certainty of evidence that the timing of gluten introduced was not associated with celiac disease risk. So if you introduce gluten, it doesn't matter when you do it, the risk for celiac disease does not change. So egg, yes, peanut, yes, gluten, negatory. All right, so here's one of the ways that they describe the way that you can introduce foods, and it's a pattern. There's a protocol, it's for food oral immunotherapy. I don't recommend that you guys do this on your own. I just want to give you this information just to give you some framework. So basically, over you start off at nothing, you work your way up over weeks or months to up dosing for the buildup phase, and then maintenance phase, and then basically you go back to eating kind of normal. That being said, this is something that should be done with an immunologist, somebody who knows a lot about food, especially because remember what we're talking about here is the early years. This is with little kids. For adults, it might be other considerations that you can take into consideration, like such as digestion and stress and all the other things we'll talk about when we get to the late age things. Here we go. Neurons do possess the capacity to auto-regulate their antioxidant defense in response to electrical activity. Okay? So we talked about how Wi-Fi and electromagnetic interference, such as signals and lights, blue light actually changes the way that your body responds. So your neurons possess the capacity. So that means it's not just chemical, it's also electronic. Something that can be very helpful is looking at your electronic environment. We talk about plenty of ways to help reduce those exposures. There's a lot of options that we have for that. But I found this really fascinating article that talked all about this, and I would love to share every bit of it with you, but we don't have time for that. But this is probably the coolest fact from it. Okay, here we go. MicroRNA. That's what comes from building genes. They orchestrate cellular redox homeostasis, which plays a central role in a multitude of physiological and pathophysiological processes. So these little microRNAs, RNA is the complement of DNA. That's the messengers that go around the body. Those are all proteins, and they can make wide sweeping changes. And the reason why I put RNA in here is because that can come from virus, and it's important to know about that. All right, so this is a summary slide, and I think it's fantastic. I made sure to use 2 different colors of purple to talk about the bad stuff down at the bottom. You're welcome. So if we look, this says environment, diet, stress, drugs, chemicals. This is the cell membrane. It's a phospholipid bilayer. It's very nice. The artist rendition here just sings to me. All right, so all of that, all of those things that can bother you, they create this reactive oxygen species, which then causes oxidative stress, and it breaks down the body's ability to respond. Now, what's really cool is right there in the center, it says antioxidant. That's how you diffuse the bomb, right? So if you can't control the chemical and environmental factors, right? If we know that there's going to be all these different things, can you control diet? Yes, to some extent, right? Even very, very low cost foods can still be very healthy as long as you have access. Now, I do know that there have been places throughout the United States that are considered to be fresh food deserts, where they don't have any fresh food whatsoever. Everything comes in either cans or tins or packs, or it's hard to find fresh food. That being said, by and large, making sure you get a broad and varied diet of fresh foods, even on a very small budget, can absolutely be achievable, and it should be something that is focused on. So you can't control all of these things. Environment, to some extent. Diet, yes. Stress, to some extent. Drugs, depending. And then chemicals, obviously. So all of those create a worse sense of this reactive oxygen species, which then depletes your antioxidants. And if you notice, as we follow down this I don't expect you to read all this stuff here, but this is the epigenome. This is the epigenetics. Down here, chromatin, remember we talked about that? That's the sheet music. It restructures based off of these stressors. So bad stuff in changes your sheet music, and then you get altered gene expression, changes in protein translation. We know protein is the driving force of pretty much your entire immune system. And then down here at the very bottom, modulation of physiological functions and pathological effects. So let me break it down for you. You put stress in the top, and it causes damage to your genes, and you come out with bad immune system at the bottom. Easy? And of course, you have histone hypoactivation if you want to talk about that. Okay. Here's how we're going to get into the early adult phase. Again, summary slide talks about all the different things, plastics, mold, lipopolysaccharide. The number one thing that I have seen that triggers allergies in adolescents to early adults is damage. This is where we see contact sports causing physical damage, broken bones, car crash, overtraining. So I've had people that were marathon runners, triathletes. I've had people that have done mixed martial arts, football, and they push and push and push and push. And then all of a sudden they start to have these weird things. Why? Why does that happen? What does physical damage do to the body? Everybody remember Mr. Wacky Face? Our favorite hammer? I think that's just a fun slide, really. Anyway, and then of course, broken bones. Most of the time people get into some shenanigans is usually right around the early adolescent phase. Not to say that as people age, they don't have as many broken bones. They just typically don't tend to do things that get them that way. Obviously, car crashes, a big thing. But tissue damage, tissue injury, it starts the entire cascade of the inflammatory process. And if you have a lot of it and you have it chronically, it can build up to long-term problems. So unintentional injury accounts for 40% of childhood deaths annually. It's very sad. But injury is a huge thing that happens all the time. And those are just cause of death. More than 8 million US children required medical attention for injuries in 2009, resulting in more than 132,000 hospital admissions. Those are just for the kids that went to the hospital, but 8 million children in a year. I'm not sure if that number's gone up or down. That was the most recent statistic I could find. If anybody has anything better, feel free to send it to me. I'll update my slides. Group project. You can help me do my homework. All right, so we know that injuries happen. And we know that when injuries happen, they can cause a bad immune response. So here's what it looks like. Falls account for 33%. Contact injury is 23.1. What does contact injury look? Oh, wait, hold on. Overexertion. Fall, contact injury, overexertion. What does that sound like? Does that sound like sports? Who plays more sports? Adolescents or elderly? Who's doing contact sports, right? At what point do most people get out of playing contact sports? Usually 25, maybe 30, but the majority of, think about it, what kind of ball games do you go to? You have high school, right? It's usually where it gets really competitive. High school and college and then pro. So, yeah, apparently bicycling is a lot safer, so in case you're curious about that. Increased intensity of sports activities combined with a decrease in daily physical activity is making overuse injuries in children more common. This is one of those trends that's happening, and I think it's very important, especially in the current state of things, that because the intensity and expectation for children both academically and athletically in sports has increased significantly. The increased intensity academically means they're sitting for longer periods of time doing more academic studies with deeper academic endeavors. And then the intensity of sports activities is something that there tends to be this evolution in intensity, and everybody is pushing for bigger, better, faster, stronger. And it turns out that it's causing more overuse injuries, making them more common, and that's bad. Okay. Pain in children during sports should not be considered normal. I have a very delicate approach to this with parents that I work with, because I absolutely think that every child should be given a chance to be a star. I think that they should have the best coaching. I think they should have the best support. But I think it's better done with support and finesse than with force. I've talked to quite a few parents that, they just tell their kid to rub some dirt on it, get back out there. Well, guess what? If you start that bad cascade early, overuse injuries, pain is not normal. Let's stay here for a second. So overuse injuries, they damage structures that are slow to heal. They cause chronic conditions, chronic inflammation, chronic itis. And even if it goes away, kids are more likely to play injured than adults because they feel like they're supposed to. And if they're not given grace, they're not given a way out, they're going to push themselves until either they can't play anymore or it hurts so bad that the rest of their life suffers. And the only thing they can do is their preferred activity of their sport. And that's just in that moment. And then you can give them all the things to cover that up. But remember, we talked about allergies as a long, slow, chronic process. What happens then in 5 years or in 10 years? All of this stuff starts creeping up. It starts showing up again. And it's probably the most common reason that we see adult onset allergies was from childhood injuries. okay, that were unresolved. Now, there's a lot of things you can do to help this, and that's the other thing. There are a lot, so the main treatment for this is the thing I wanted to focus on here. The main treatment for these injuries is temporary suspension of the athletic activities combined with conservative care. They recommended physical therapy as the main route of conservative care. Nowhere in here do they mention nutrition. And surgery may be performed if conservative treatment fails. Tendon overuse injuries and tendinitis are accompanied by catabolic process and apoptosis of tenocytes. That basically says the reason why you have mechanical problems from all of this stuff is because there is an itis. Let me use this, itis. See my friend itis here? Catabolic process. That means the breaking down of tissue. Where does that tissue go? If you remember in our previous conversations, we talked about how the spleen is the biggest lymph organ in the body. It's the sewer system. It gathers that, and it picks through the garbage to find proteins. Then it sends that message to the thymus to tell your thymic cells, your T cells, what to attack. Nowhere in here, nowhere have I found, and I looked, I had like 1,200 articles. I'm going to write 4 more of these presentations. You're going to love it. Just keep showing up. Nowhere have I found anywhere where they talk about the use of antioxidants and nutritional therapies. They say, oh, you have a mechanical overuse injury. It's probably because you're not using it correctly. They don't talk about neurology, -1. They talk about the mechanics. They don't talk about the chemistry. They talk about behavior. So if y'all have been with me through some of these presentations, you know the healing sequence that your body requires in order to heal, yeah? Neurological first, mechanical second, chemical third, behavioral fourth. That's in my whiplash presentation. It is the thing that I've spent the most time doing clinically. So I have a ton of theory that I've studied, and I love it. It's fantastic. It's my bedtime story. These are my superheroes and my celebrity gossip all rolled into one. It's fabulous. But from a day-to-day operational standpoint, the thing that I drive home with my patients every single time they ask, what do I need? I had a guy today. He's like, well, can you give me some exercises? No, neurologically you're unstable. More exercise on an unstable problem is going to cause the joint to be worse. Why? If you don't have the nerve controlling the muscles, controlling the bones in the joint's going to move more than it should from the normal range of motion into the pathological range of motion, causing inflammation, causing tissue damage. Tissue damage, tendinitis. Why do tendons become inflamed? Because they've been pulled more than they should. They've been overworked. Why are they overworked? Either you're doing way too much behavioral, or you don't have control over that joint, neurological. The current medical standard, I've gotten secondhand from a bunch of my patients that come to talk to me. They say, oh, well, they told me to stop doing the thing. I'm sorry. Hold on. Suspension of athletic activities. This is straight out of the guidelines. That's behavioral. That is the least impactful. Stop doing the thing. Do you know one thing I've learned about runners? They don't stop running. I had a lady come to see me. She had heel pain. Sent her for an x-ray. Turns out it was broken. Broken. Snapped. It's 2 pieces now. This should just be 1. And she said, well, my podiatrist said I could probably get it screwed back together. We'll just bolt this piece back to that piece, and they'll put some bone glue in it. Fantastic. And it's the right thing to do. At that point, beautiful. Thank God for surgery, right? Because now she can actually walk around. This was 6 weeks before the Chicago Marathon. Guess what her question was? You got it. Can I go run? And I said to her, I said, Linda, no. She's like, well, what if I just take with like an easy 26.2? And she's like, if I just go take an easy marathon. No. So behavior is not the way to fix it, because that wasn't even really her problem. I mean, was she poorly behaved around her injury? Yes. But I could guarantee you that her chemistry wasn't right. I could guarantee you that her fibrous tissue wasn't fixed. And I can absolutely guarantee that her nerves weren't working properly. She had everything working against her, and the only thing she cared about was behavior. That's the least effective way to deal with things. Conservative care, basically, they tell you to stop using it. Rest, ice, elevation, compression, right? Fabulous. What about the nerve? Why are we talking about this anyway, in context of allergies? Guess what happens when you repeatedly damage something? See this word right here? Apoptosis. You don't pronounce the second P. It's A-pa, and this is tosis. Anyway, of the tenocytes. Tenocytes. So we talked about this in the first presentation. This is aberrant cell death. That means they died the wrong way. They didn't recycle, they didn't get broken down. They just died. Blah. And those are tenocytes. Cyte means cell, teno is of the tendon variety. These are the cells that rebuild your tendons. And they died wrongly. Guess what your immune system's gonna go do? It's gonna go for an investigation. Why did it happen? It's gonna go clean up the crime scene. Yeah? And if I didn't make it abundantly obvious, you can get an allergy for that. You can have an autoimmune problem for your tendons and ligaments from this exact process. I figure I should say that. Okay. I was like, yeah, duh, it's obvious to me, but I might not have emphasized that because we're talking about stuff. Okay. How not to get an allergy or autoimmune disease? Resveratrol, love it, inhibited interleukin 1 beta, IL-1B, and nicotinamide-induced NF-kappa beta activation and P65 acetylation and suppression of the activation of the thing, kappa beta alpha kinase. Anyway, so those are all immune modulatory components, but they're all of these things. So everything after resveratrol, inflammatory. So resveratrol stopped inflammation. Huh? Right? Thanks. I was translating. Next. Okay. Resveratrol also reversed, love it, reversed, not just stopped, but actively fixed the upregulation of various gene products that mediate inflammation. Wait a second. We're talking about epigenetics right now? I'm super excited. Watch this. All right, so gene products that mediate inflammation. So resveratrol works on your epigenetic factors to turn off your genes that make you have more inflammation. Yeah. So resveratrol is getting down into the grit in reversing where your genes got turned up to crank out inflammation after inflammation. So many people I've talked to said, I've tried this and I've done that and I've fixed my diet. Why do I still have all this inflammation? Because you've been reprogrammed through your environmental exposures to have bad genes now. Resveratrol fixes that. Love it. All right. The aim of this study was to investigate the regulatory effects of taurine. Anybody know what taurine is? Me either. No, I'm just kidding. Taurine is an essential amino acid. And it's one of those that you get. Taurine comes from bulls. Taurus? Taurine? Okay, yeah, there you go. Yeah, so it's a little mnemonic for you. So taurine is an amino acid that comes from mostly beef, but it comes from other things because it's an essential amino acid. And if you don't digest by overuse. So this is for all my athletes out there that want to stay kicking it. If you don't have enough taurine, or if you don't have good digestion to get the taurine from your food that you're eating, then you're going to miss out on this fantastic component. The quadricep muscles, so basically, I'm going to take a step back because this is the middle of the thing. This is pages and pages and pages long. I just grabbed a chunk and put it up here to share it with you. So basically what they did is they took a bunch of rats, ran them on a treadmill, overworked them for like a whole month, and some of them they gave taurine, the other ones they didn't. They checked the quadricep muscle for histological analysis and evaluation. What is histology? Histology is the study of tissue. Muscles, bones, joints, nerves, ligaments, tendons. It's the substance. So if you've ever seen like under a magnifying glass, there's a picture of like cells. That's histology, right? So if you're looking at cells under a microscope. All right, so they did that and they evaluated mitochondrial function, oxidative stress, So why do you need antioxidants? Because of oxidative stress. Do we need to go back to this reactive oxygen species? Hold on. I'll back this whole bus up. Let's go. Let's go. Oh, here. Boom. Hey, what do we have here? Oxidative stress. Who would have thought? Talked about that before. And fast forward. Woo. Oh, did I miss it? There we go. Haha. There we go. So, oxidative stress. Tissue repair, so histology tissue, that makes sense. DNA damage markers. Do you know what DNA damage leads to? Hyper or hypoimmunity. Hyperimmunity is what we're talking about today. Too much going on. Your body attacks the wrong thing. You know what hypoimmunity is? Hypoimmunity. Those are neoplastic diseases. Cancer. Cancer. So if you get enough DNA damage and you don't have the nutrition to fix it, your body makes a copy of a copy of a copy using bad stock. Eventually, you run out enough stuff and it just breaks down completely, and then cancer. Oops. So they studied that because that's super important. Can you, based off of the information we talked about with this slide, muscle overuse injury and DNA damage, can you exercise your way to cancer? Yes. Can you exercise your way to autoimmune disease? Also yes. Okay, 2 points for anybody who got both those questions right. So they looked at this in context of more taurine or less taurine. Taken together, these data suggest that taurine supplementation modulates various cellular remodeling parameters after overuse-induced muscle damage, that these positive effects may be related to its antioxidant capacity. What? So basically, the thing that I think is interesting about this is they completely missed the fact that taurine is an amino acid that helps to build muscle. So if you have muscle damage and you're not getting the proper digestion and absorption of all the stuff you need, then it causes everything to break down. But that can be moderated by getting either supplemental taurine or by getting enough taurine in your diet. Yeah? All right. 20 to 40. Stress. Can you have mold problems at any age? Yes. Can you have pharmaceuticals? Can you have pollutants, mineral oil? Sure. PTSD, chronic stress, poor sleep, electrosmog, yada, yada, yada. Yeah, sure. You sure can. But you know what I hear? What's that? What is lipopolysaccharides. Oh, man. Jameson, we're going back. All right. We're going back to the other side. So lipopolysaccharides are basically fiberglass, like little molecules. They're made of protein. They're not actually made of glass because that'd be silica. But they're protein molecules that are given off by certain bacteria, mold, fungus, yeast, and some virins, right? Some viruses. And they basically are like, they're spiky, and they just aggravate everything going on in your gut. They can ride up your vagus nerve to your brain and cause your brain to have all sorts of crazy inflammation, make it so you can't sleep, give you anxiety, depression. Typically, when people have yeast die off, they'll get a huge load of lipopolysaccharides. They also accelerate joint degeneration. So in a lot of these models where they're talking about they studied an arthritic joint, they took lipopolysaccharides and injected it into the joint just to watch it degenerate, so they could see if they could fix it with others. Because you have to start with a degenerative joint. So if you can force a joint to degenerate with lipopolysaccharides, imagine what that does to the rest of your body, right? So many people come in like, oh, I got a gouty toe. No, you don't got a gouty toe. We check. They don't have gout. Why does that toe hurt? Why is the bone edge all gnarly and gross? Because they have lipopolysaccharides. Because they have a bunch of other yeast and mold and garbage going on in their body. They got a war going on and they're losing because they're not clearing it fast enough. Sucks. Ooh, what else? I like those. I mean, I could stand up here and drone on like a bagpipe. But anyway, full hot air. Okay, so lipopolysaccharides. Thanks for asking the question. Okay, stress. Acute stress, chronic stress. Doing this gets you here. Follow me for more tips. Okay. Oh, wow, that looks great. All blown up on that. It would look better when it was smaller. Okay. This is the first time I've seen this on the big screen, so we're just learning this together. Okay. Body, mind, emotions, behavior. Stress. So headaches in the body. We're going to start up here in the top corner with body, mind, behavior, emotions. We'll go clockwise. Breathlessness, skin irritations, fatigue, muscle twitches, tight muscles, frequent infections. Frequent infections, what does that cause? Oh, I don't know, allergies and autoimmunity if you constantly provoke the body. Oops, right? Mind, worrying, muddled thinking, impaired judgment, nightmares, indecisions, negativity, hasty decisions. That could lead to some problems, yeah? Behavior, accident-prone, loss of appetite, loss of sex drive, drinking more. Probably not water, right? That's probably alcohol we're talking about there. As a way to relieve stress, insomnia, restlessness, and smoking more. Emotions, apprehension, alienation, apathy, depression, irritability, more fussy, and less confidence. What's interesting is loss of confidence, more fussy, irritability, all of this is derived through hormones in the blood. And a lot of that's affected by your posture. There was a study that showed that if you slump for about 3 minutes, it drives your testosterone down and your cortisol up. Testosterone makes you like courageous and brave and helps you with better decision making. Cortisol makes you worse at all of those things, right? And that's just with posture changes. So, good handle on stress. Okay, symptoms of depressed mood and anxiety have been associated with immune dysregulation and atopic disorders. What is atopic? That means it's just somewhere that it shouldn't be. A means away from, topic means what you think it does, like the topic of conversation. Topography is the overall lay of the land. So this atopic basically means it's in the wrong place. From the first presentation, we talked about how gut problems show up in the epithelium. The epithelium is the linings of everything. It's lining of your eyes, your nose, reproductive stuff, kidneys, bladder, uterus if you got one, brain, all over the place, lungs. So it's this problem that starts somewhere and goes everywhere. It goes to the wrong location. So symptoms of depressed mood and anxiety have been associated with immune dysregulation and atopic disorders. That sucks, right? I mean, that's how psychology turns into chronic pain and syndromes. Oops. Lifetime history. This is a fascinating study because they've done the reverse to see if people with autoimmune disease have problems with psychological diseases. This is the other way. This is looking at if psychology can make your immune system break down. Turns out it's true. Lifetime history of major depressive disorder, that's MDD, generalized anxiety disorder, GAD, panic disorder, which is PD, and post-traumatic stress disorder, which is PTSD, was assessed using this very important diagnostic inventory. This is the gold standard currently what's being used. So they looked at all these things and said, hey, what does that have to do with anything? The study confirms the association between major depressive disorder and panic disorder and seasonal allergies. What? Yeah. And extends this relationship to generalized anxiety disorder and post-traumatic stress disorder. So they looked at psychology as a driving factor for allergies and autoimmunity. Absolutely true. All right, here's a fun one. And it uses some big words, so I'm going to break it down. The hypothalamic pituitary adrenal axis, the HPA axis. This is a huge conversation in physiology. Why? Hypothalamus is brain. Pituitary is the brain to hormone connection point, and adrenal is basically your fight or flight regulatory organ, shall we say? I say organ because it has brain tissue in its core, and it has endocrine and exocrine functions. So it's both a local and global hormone regulator. It also has electrical functions because it changes your water balance, which is wild. It's like its own little creature living in there. It's fascinating stuff. Anyway, so I love this right here. Neuroendocrine. There's no space. It's not neurological system and or endocrine system. It's neuroendocrine because it's both. Endocrine is hormones. Neuro is brain hormone system, right? And it responds. So this HPA axis is one of the body's neuroendocrine networks. It's a network, right? So it's a bunch of different pieces that responds to psychological stress. I don't think it gets clearer than that. I'm so happy I found this because I found all these little bits and pieces that talked about the function of the adrenal glands or some connection to the hypothalamus or how pituitary modifying factors and immune system stuff. Like it was really just dancing around the edges, and this one's like bang right in the middle. Neuroendocrine network that responds to psychological stress. Direct correlation. Psychological stress, control of the body. Okay. The skin, there exists a peripheral HPA axis, similar to the central. Your skin has its own. Your skin is also like its own kind of creature. It's weird. It has its own. They're separate and distinct, but they share a lot of chemistry. They share a lot of neurology. I got pictures to prove it. All right. Oh, I'm surfing up here. All right. So here we have there's just so much going on. Okay. I got to point out one thing. Okay, up here. So allergens, so this is the skin, right? This is the dendritic cell. This is all the stuff on the outside. You can have allergens come in and mess with things. You can have whatever tool means, scratching or bacteria, all right? So you have all of these things that affect the skin, and that drives all this down to affect the blood level, the peripheral HPA axis, cortisol, HCTH, and histamine, which then drives the decrease in lipid synthesis, which then breaks down the skin. Remember we talked about when these cells get perturbed and the immune system keeps showing up and showing up and showing up, eventually it starts to attack the wrong things. That's a direct mechanism, and it's controlled in the skin. It has its own feedback loop. It doesn't have to go through the entire body system to get there. It manages itself. Sometimes it mismanages itself. I worked on ladies that had traumatic events in their life, and the big issue for them was their skin was falling off. It looked like, and to varying degrees. I mean, and I felt really bad, and we helped them. I mean, a lot of them. I think so far I'm batting 1,000 on that. Some of them a little longer, some a little easier. But it is absolutely. I've absolutely seen in my clinic, hands-on, traumatic event leading to an immune system breakdown due to psychological stress that causes what basically, and it was diagnosed as different skin infections and different skin lesions. But guess what? That can all happen right here, because as this breaks down, you're more susceptible to bacterial infections. What happens if this happens to a person who then actually gets on top of their broken down system a real infection? Then they get treated for the infection. Does it fix the underlying problem? No. I have a lot of dermatological referrals for this. Here's another thing that happens. Substance P, sensitive nerve ending. So interleukin 1, interleukin 6, tumor necrosis factor alpha, interleukin 18, all of this stuff, these are all chemicals we talked about that circulate through the blood. And then down here you have the capillaries, right? Plasma cell, mast cell, a bunch of other stuff, and then it's mediated by the central HPA axis. So you have this local environment that happens up here, and then you have this global environment that either can contribute to it or be affected by it. Because if the skin is dumping a bunch of this bad chemistry into the blood, where do you think it's going to go? The rest of the bloodstream. What do you think is going to happen in the rest of the bloodstream? It's going to provoke the central HPA, right? You're going to provoke the central system that controls all that stuff. So you can have a skin thing that turns into a body thing. You can have a body thing that turns into a skin thing. Or you can have both of that happens at the same time. Yuck. Okay. So, yeah, I think that's good. This basically is the same thing. Skin barrier impairment. Remember, that's epithelium, so that shares a lot of the same proteins. Those go back to the blood. The spleen finds them, sends them to the thymus, blah, blah, blah. People talk about mast cell activation as part of the problem. Yeah, that's there. That could be triggered by mold, too. I'm part of a very unfortunate community on Facebook, and it's all about this stuff. And one of the biggest things people complain about is mold and chronic multiple chemical sensitivities. And it's not really well defined and not really well explained. There's a couple people that are doing some great work. I think we should totally keep that up. But this is another one of those things that factors in. So mast cell activation is a huge conversation, histamine. But also, if we look over here, adrenaline and noradrenaline. Look what that's linked to, psychological stress, right? Oh, there's our friend melatonin. Yay, okay. Last thing, substance P. That's a chemical that tells your nerves to feel as though they are on fire. It feels just like being burned. It's the burning pain feeling, substance P. It increases and sensitizes all nerves. Oops. Okay. Chronic T helper cell type 2, predominant cytokine profile, acts as a negative feedback loop to blunt the HB excess in response to atopic dermatitis. So basically what happens is there's this T helper cell. We talked about this before. That's why I put this slide in, because I think it's really important to connect this to the previous conversations we were having. But that cell is it shows up and it acts as a negative feedback loop. So basically so your body's always trying to seek balance, right? It's always like trying to find its way back to center. This stops that. This basically says, well, it's bad, so let's make it worse. And it gets continually worse because it blocks its own ability to heal. And that's very common in the atopic dermatitis. So dermatitis caused by something other than contact. So there's contact dermatitis, like if you rub on poison ivy, contact dermatitis, right? Atopic dermatitis means it comes from somewhere else. Okay, switching gears quick. Insomnia is highly prevalent among asthmatics. However, few studies have investigated insomnia symptoms and asthma development. Remember we talked about sleep? Hang on with me. Wait for it. Boom. Stress. Poor sleep. See? Right there. We talked about the chronic stress. Talked about a little PTSD. Poor sleep. Ready? Here we go. Woo-dow. Nope. That one. Okay. Insomnia is highly prevalent among asthmatics. However, they haven't studied whether insomnia affects asthma, and that's what we're looking at here. The risk of developing asthma in those with chronic insomnia was 3 times higher. There it is. Insomnia as a driver of asthma. And asthma, we know, is inflammatory. It's allergenic, autoimmune. It's kind of on the border. So it's 3 times higher if you have chronic insomnia. Central circadian clock tunes the innate circadian physiological rhythms to an ambient 24-hour light-dark cycle to invigorate and optimize the internal temporal order. Oh, so good. Your brain has a clock. There's a whole bunch of other sciencey words. I deleted those. This is as lean as I could get it. I'm sorry. But there's a part of your brain that is the timekeeping mechanism. I don't have that. That's why this presentation just keeps going. But you have an innate circadian cycle. You have 6 independent body clocks. They're all regulated by a part of your brain. And it is driven by light, dark. What happens if you stay up too late? What happens if you have false lighting? What happens if you do shift work? That gets thrown off. What happens if you're staring at your phone till 3 o'clock in the morning? Your brain still thinks it's sunlight out because the only place you get blue light is from the sun and electronics. And this happened recently because all of our lighting used to be yellow or red spectrum. Incandescent bulbs, candles, right? The fire that burns to light your home is not blue because it's not gas. It's yellow and red, right? So the blue light, they've shown that people have an increased risk of cancer after hyper white streetlights are put in. They've shown that incidents of cancer have gone up. Why? Because the whole light-dark cycle is broken. Because you lose your internal temporal order. That's another way to say self-regulating. Your body's self-regulating itself. Melatonin, however, conveys the message of darkness to the clock and induces night state physiological functions. For example, sleep-wake, blood pressure. Blood pressure. So here's the thing. I talk to a lot of people, and a lot of people are on blood pressure medications, which I think is great. Please don't die, right? Let's just start there. Glad you're alive. Glad you have it. If you need it, fantastic. My question isn't, should we take people off of blood pressure medication? My question is there a better way to solve it? Is there something else going on beneath the surface that we're not looking at that could give us answers on how to fix it? This gives us a hint. It says, yeah, there is. Because your blood pressure changes. And also metabolism. Melatonin can fix your metabolism. Look, see it? Should I point with this thing? Melatonin, metabolism. Melatonin, okay, point made. Here we go. Clinically meaningful effects of melatonin treatment have demonstrated placebo-controlled trials in humans. We've studied this stuff and it does great. And there is a whole presentation. I sat through 3 hours of a presentation with Dr. Harris, and he is arguably one of the smartest people alive in medicine, and he said his presentation could have been a week long, and I probably would have stayed for the whole thing. But that being said, lots and lots of people all agree that melatonin has an effect, and there's a lot going on with it. So let's talk about over 40. This is gonna be kind of getting close to the end. So, and we started off in the beginning, there was a lot to cover, but everything we talked about at the beginning applies to everything thereafter, right? And we're just highlighting at different ages. So the thing that happens to people, by the way, in Chinese medicine, they say in age, treat the liver. And when they say age, they mean 40 or older. I was like, rude. I know. Anyway, turns out there's a lot of things that happen to the body physiologically at 40. It's one of the marker points that we use in health and medicine. Also, there's a huge drop-off in your digestive enzymes. By the time you're 40, they're half of what you were when they were when you were 20. So digestion. If you're like 30, 35, start thinking about it. If you're 40 plus, get on it. You're already late. Okay. Exhaustion. Yep. Exhaustion. The decline in immunocompetence with age is accompanied with an increase in the incidence of autoimmune diseases. Well, that's rude. Basically says as you get older, your immune system shuts off. But by the way, it's not just not doing enough, it's also doing a bunch of wrong things. So the part that should do its job isn't, and the part that's acting up is worse. Why do you think that is? What do you think that happens to metals if you don't specifically treat them? What do you think happens to plastics and environmental toxins? What do you think that happens to stress? PTSDs, right? All of the things that we can measure. Does indigestion typically resolve itself magically with age? No. Almost everything on here gets worse the longer you do it. Time is a catalyst. A lot of people chalk up to age, like, oh, that's just what happens when you get older. Especially if you didn't take care of the problems through all the other things we've talked about. If your mom, while you were in utero, had a bunch of issues, and then you were born had a bunch of issues, and then adolescence had a bunch of issues, then 20 to 40 had a bunch of issues, and you didn't take care of them, where do you think they show up? They just keep compounding on as life goes on. So yeah, by the time, if you're over 40 and you're starting to express symptoms, your body's had it. It needs some help, and it might need help in all of these categories. Aging of the immune system, or immunosenescence, is characterized by a decline of both T and B cell function. Remember, those are the cells that regulate your immune system. They just do less as time goes on. Here's the fun word, paradoxically. So they do less, but with immunosenescence, your T and B cells do less, but you get a chronic low-grade inflammation. Well, that sucks, right? So your immune system does less, your T and B cells do less, but you have more low-grade chronic inflammation. And what that bottom line, low-grade chronic inflammation, what do we know that associates with? 100% allergy and autoimmunity. It's not an acute thing, it's a low smoldering problem. All right, emerging evidence suggests a key role for epigenetics all the way at the end of the presentation. That's amazing. It started off in the very beginning and showed up all the way through and at the end. You think it's important? Yes. In human pathologies, including inflammatory and neoplastic disorders. Remember we talked about inflammatory. Inflammatory leads to what? Allergy, autoimmunity. Remember we talked about neoplastic, right? Your immune system either does too much or too little. There you go. Some people it's both. Oops. We made it. I mean, we can go back. We can cover a couple slides. I got more details. All right, no? Okay. All right. Let me leave you with a few closing points. I got to fix my... All right. I like to give principles because rules change often. Principles never change. Structure times function is quality of life. We talked about structural problems in the body. Muscles, bones, nerves, damage, yes. So we talked about functional, immune system, digestion, yes. If you have perfect structure but terrible function, your quality of life will be terrible, right? It is the lesser of the two because the one is multiplied by the other. So I know people that focus solely on function and look not at all at structure. What is their chance of success? It is multiplied by the lowest common denominator to give you the quality of life. That being said, if quality of life is not important to you, then you don't have to worry about it. You're already there. You're good. I work with a lady, and she's a very sweet lady. She is really allergic to certain things that she absolutely refuses to stop eating, and she's always inflamed. And every time I poke her, she says, "Ow, that hurts. So I thought you were going to fix that last time." I said, "What have you been eating?" She's like, "All the things I shouldn't be." I said, "Well, I did fix it. You went and broke it again." And she's perfectly okay with that. And I'm perfectly okay with the fact that she's perfectly okay with it. She doesn't tell me to badger her. She doesn't hire me to like tell her how to live her life. She wants me to help her, so I do. And then I gently remind her every time. Okay, input times process equals product or output, right? So one of the things I see a lot in this field, because I critically evaluate everything, I'm like, why are you doing that? You know, I can't just accept anything on blind faith. I gotta like, no, I gotta pick it apart, rebuild it, put it back together. And I have. So input. So this is the stuff that people talk about. I've done this is my food, these are my nutrients, I've taken this, I've tried this, I've done all these things. Surgery, medications, whatever. I mean, pick whatever you want. I will be honest with you, by the time we're having this conversation with people, they've seen a whole slew of other doctors, rheumatologists, allergists, gastroenterologists, ENTs, depending on where the problems show up. And a lot of them are input doctors. They're telling you how to manage your inputs and what to take and what not to take. And sometimes that helps, and it's great. And I'm glad that it does. Like I said before, I'm not here to replace everybody else. I'm here to fill in the gaps. Anything that hasn't worked or people that don't fit the standard, that's what I'm here to do. Because I mainly, and now granted, I do look at input, but mainly I focus on process. How is your body doing with what it's being given? Remember, there's 3 stages of digestion. There's food behavior, what you choose to eat. There's digestion and absorption, which is a process, not an input, right? Eating is an input. Digestion is a process. And then the allergy autoimmunity components, that's also a process. So 2/3 of just your daily routine of how you eat is all about process. And if there's ways that we can stimulate your body to process things better or make sure that we're filling in gaps, you're going to do a whole lot better. The product, that's the output. That's what you want. That's the result you're looking for. That's why you come to my office and have me figure out what's wrong. Because you have a motivating factor, because there's something in your life that you're missing. There is a greatness that exists in all people that expresses itself when suffering is at a minimum. This is why all of this is important. Because the thing that I am out to help is to reduce suffering so that people can experience and express the greatest of themselves. The body is an environment with finite resources. This is so important, especially for people that haven't hit the 40 where they're exhausted or the 20 to 40 where they're stressed. This is for all the youngins. The body is an environment. It's not a calculator. You can't do bad and then do good and have it equal 0. It's an environment. Sometimes if you trim the tree too hard, the whole thing dies, right? The body is an environment with finite resources. It is finite. It is not infinite. There are limited resources. You have to respect that. And if you don't, you will suffer the consequence, which is exactly what this talks about. Nowhere else does the law of supply and demand show greater penalty for ignorance than in biological economy. I put this on here. We have 3 sides of the triangle. This is the triangle of health. You have physical, structural, mental, emotional, and electrical, chemical. We've spent a lot of time putting pieces on this triangle. If y'all need help, reach out. I'm here for you. And with that, I send you off. Thank you for attending.